Spine surgery isn't always like flipping a light switch. It can be more like adjusting a dimmer. I'm Dr. Kelly Bridges, board-certified neurosurgeon, and I want to talk about something that surprises many patients after spine surgery: why healing can take longer than expected. Let's start with nerve recovery. When we decompress the spinal cord or nerve roots, whether in the neck or lower back, we're relieving pressure. But the nerves themselves may have been inflamed or compressed for months, even years. And nerves don't heal overnight. In fact, nerve regeneration can take months, sometimes up to a year or more, depending on the severity of the damage. Studies show that most nerve recovery occurs within the first 3 to 6 months, but improvements can continue for up to 18 to 24 months in some cases. That's why a person may not regain full function in a hand or a foot immediately after surgery. It's not that the surgery didn't work, it's that the nervous system is still catching up. Now, let's talk about spinal fusion. When we perform a fusion, we are asking the body to grow new bone between vertebrae. That process, called arthrodesis, is slow and biologically complex. It typically takes 6 to 12 months for the bone to fully fuse. Until that fusion is solid, patients may continue to experience neck or back pain, especially with movement or stress. Pain relief after fusion surgery is often gradual, not immediate. And it's important to understand that the full benefit of fusion, both in terms of pain reduction and spine stability, may not be realized until the fusion is complete. So if you're recovering from spine surgery and wondering why things aren't improving as fast as you hoped, remember, nerves heal slowly, bone fusion takes time, and your body is doing deep, invisible work to restore function. Healing after spine surgery is a journey, not an instant transformation. And if this helped you better understand why progress takes time, like this video, save it as a reminder for the tough days, and share it with anyone recovering from surgery or supporting someone who is. Be sure to follow and subscribe for more insights on spine health, surgical recovery, and building resilience one step at a time.